And my fourth concern about diagnosis is that when we get an internal derangement, we distort the skeleton. You see, we look at teeth. We always look at teeth, and it's pretty understandable. If I'm losing dimension in the TMJ, I'm going to end up premature on a back tooth, and I'm going to start opening my bite here. Okay, the patient's not going to be able to get their teeth together anymore. But the face changes, and the facial change, you could take a patient who starts out with good dimension in the TM joint, and as they lose vertical dimension in the joint, the distortion of the joint creates an elongation of the front of the face. All right, 1 year later, this lady degenerated her temporomandibular joint. She's got a marked elongation of the lower 1/3 of her face because everything is fulcruming off of the second molars. She's losing ramus height distal to the second molars, fulcruming off of the second molars, and the front of the face has to elongate. It's a teeter-totter, okay? And so as this face elongates, you begin to see these kinds of structural changes. If it's happening on one side, then you see asymmetry progress over a year. You see the chin progressively deviating towards the side of the defect. Very, very common to see these kinds of alterations. Here's a lady who had restorative dentistry. Okay, she came in with this bite. Okay, so this is the occlusal scheme. And you can see very classical patterning that she's trying to develop a cross bite on the side where the condyle is breaking down. Her biggest open bite is at the opposite cuspid. These teeth in the right posterior no longer touch. So she's treated with restorative work and an osteotomy, okay, to fix the bite. She's still hurt. So with the restorations in place, the osteotomy is finished. She's put into a splint, but guess what? The foundation's not stable. So by wearing the splint and having an unstable foundation, in spite of all of this work, guess what the bite does after the work is completed? So it doesn't matter what her pain's doing. What matters for her long-term stability for her bite is what is going on in terms of long-term stability for her temporomandibular joint. Doesn't matter about the margins of the teeth. And these teeth were beautifully matched. They were beautifully equilibrated, okay? This came out of a major restorative practice of very, very high reputation. I did the bite surgery, okay? And in spite of doing those things to these teeth, this patient ended up with this open bite because her foundation was still changing. But not only did the foundation of the bite change, look at her face. When you look at the face, as she has gradually lost projection in her temporomandibular joint, several different things now are happening in this patient. Basically, if I were to draw a vertical line from her forehead through her upper lip, the chin point should be 4 millimeters behind that line. If that chin is losing projection, it's going to drop back. Ramus height. You can measure ramus height. Ramus height should be 65 to 75 millimeters. When you see a ramus height dropping down under 65 millimeters, that basically means that that patient has lost dimension here, and their projection of their mandible is going to look like this, steep mandibular plane angle, okay? And in her case, when you look at her from the front, she's got this open bite here, but guess what the chin's doing? The chin is deviating towards this damaged left temporomandibular joint. It's not just the bite. This is what I'm talking about pattern recognition. You walk down the street and you say, that is a TMD patient, okay? I don't even have to talk to them. That is a TMD patient. And if you weren't looking at the face, you should be able to look at the patient's bite and say, that is a TMD patient. That's the only explanation for that particular bite pattern, you know, unless somebody cut their condyle off. That's the only way it gets there, okay? And likewise, patients like this is a TMJ patient, okay? This is a patient who has lost tremendous projection to her chin. If you don't look at her face and you looked at her bite, you should say, this is a TMJ patient. Now, some people would say, that's a tongue thrust patient. Hold on. I'll show you her images 10 years before this, and she didn't have a tongue thrust. So, is this where you're going to recognize the patient? Okay, that they have a TMD problem? What if her load test is negative? Does that mean she's not a TMD patient? She had a negative load test, by the way. All right. That mind's eye diagnosis is not going to be accurate. She's got a very serious TMJ problem. Lots of things going on.